Good morning, everyone. This is Janet Hazelton. Thanks for joining our call this morning. I wanted to share with you what we know so far about COVID-19 preparedness and the information we are gathering provincially, nationally, and internationally on a daily basis as we learn more about this disease. If you wish to ask questions or provide insight on this matter, please email us at nsnu.office@nsnu.ca. Could you please provide your first name and where you work included in your question? You can be specific or tell us the general area in which you are employed, acute care, long-term care, or community. We want to know if your workplace is prepared and how confident you are about your personal protection and that of others you work with or care for. We are hoping that if there are areas requiring attention, that we can collectively advocate for improvements should our province experience an outbreak of the virus. So just to let you know, we've been very, very active on this COVID-19. I got to say, I think I've done nothing else since probably 2 weeks, meeting and talking to people and trying to get the latest and best information in order to advocate on your behalf. We've been meeting with the employers and government representatives because we want to make sure that Nova Scotia is prepared, and it's a priority and the priority from our perspective is the safety of our nurses and the other healthcare workers. Last week, I spoke with the CEO of the Health Authority, the Chief Medical Officer, and the Minister of Health to say nurses' unions expect to be part of stakeholder discussions going forward. We also sent a letter to the Health Minister on this matter in conjunction with other healthcare unions. N95 respirators and precautionary principle. The government and the employers in Nova Scotia are recommending surgical masks. This is a recommendation from the Public Health Agency of Canada and the World Health Organization. However, many reputable organizations are recommending the use of N95 respirators due to the potential aerosolization of the COVID-19 virus through coughing and sneezing, including, so these are the people that are telling us that we should be using N95s, the U.S. Center for Disease Control, which is obviously represents the whole of the US of A, the Ontario government, and we believe the Ontario government is being very cautious because, as you can recall, they had 2 nurses and a physician die of SARS. And so they're taking the precautionary principle. The Center for Infectious Disease Policy and Research out of the University of Minnesota. The Serious Communicable Disease Unit at the Emory University Hospital. So these not individuals, but these organizations are saying that healthcare workers, obviously nurses, should be wearing N95s. This tells us, and should tell, in our view, the government and our employers that the science isn't certain. So, if you have the U.S. Center for Disease Control saying nurses and healthcare workers should be wearing N95s when they're testing for the disease, then if they're saying it, then we believe our government and our employers should be saying the same thing. Following the SARS crisis, Justice Campbell outlined the precautionary principle for just this situation. And I quote, "In the absence of scientific certainty, we must err on the side of caution. This means providing workers with N95 masks. The N95 mask is designed to protect against 95% of airborne particulates free of oil when tested against a 0.3 micron particle. The NSNU recommends that all nurses participating in testing of suspected COVID-19 patients demand a fit-tested N95 mask and refuse this work until one is provided. As per the Nova Scotia Occupational Health and Safety Act, an employee may refuse to do any act where they have reasonable grounds for believing that it is likely to endanger their health or safety or the health or safety of any other person. When exercising the right to refuse, you, an employee, must immediately report it to your supervisor. Where the matter is not dealt with to the employee's satisfaction, report it to the Health and Safety Committee, and Where the matter is still not dealt with to the employee satisfaction, you can report it to the Department of Labor. And we will put the Department of Labor's contact information on our COVID-19 webpage. Until the matter is resolved, no other employee shall be assigned the work unless they agree to it after they are first informed of the previous refusal and the reasons for it. Further, employees who refuse unsafe work cannot be discriminated against with respect to pay or other work conditions. So once you report it to your manager, they should take action. In our view, they should provide you with an N95 mask. If that doesn't happen, you can report it to your Occupational Health and Safety Committee, and you can call the Department of Labor. You cannot be fired for refusing to care for someone under these circumstances. You can call us, our office, at 902-469-1474 or 1-800-469-1474. I want to let you know that this afternoon at 1:30, myself and Paul Curry, who's our Occupational Health and Safety Specialist, and Chris, who is our Albrecht, who's our Executive Director, we will be meeting with the other three healthcare unions, which is CUPE, Unifor, and the NSGEU, with the Department of Health and infectious disease specialists. The whole purpose of the meeting is N95, personal protective equipment, and what is reasonable for us. Well, they believe what we're asking for is unreasonable, and they want to convince us or prove to us that the N95 is not necessary. So they are communicating with us this afternoon. If our position changes on the N95 masks need, we will be letting you know as soon as the meeting's over that we were convinced. So I just wanted to put that out there. Watch your campaigner. Go on it will be up on our COVID-19 webpage if all four unions decide that the N95 is not necessary. But right now, this morning, as it stands, we believe all of the nurses out there testing in those testing sites, doing testing for people that have symptoms, because according to 811, you have to have been in an affected location like Italy. If you came back and you had a fever or unexpected cough, you had to call 811, and they're going to direct you to a site where a nurse is going to test you for the COVID-19 virus. Our view is that those nurses should have the N95 on, gloves, gowns, and a shield. And my understanding is today they're only being provided with surgical masks, which I disagree with, the nurses union disagrees with, and the other nurse unions across this country disagree with. Employers in Nova Scotia, including the Health Authority, have ordered that aerosol-generating medical procedures take place in an airborne isolated room. Examples of such procedures include suctioning, trachea, aerosol or nebulized medications, nasopharyngeal aspirations, bronchoscopies, or anything that will induce sputum. And we all know what that is. Healthcare workers should wear gloves, gowns, eye protection, and an N95 respiratory mask. Furthermore, such procedures should only be performed when medically necessary. The NSNU and employers are in agreement on this issue. So I want to remind all of you nurses that are working in community and in long-term care, you have no such rooms. So that no one should be doing any of these procedures in a home and or in a long-term care facilities, because you do not have these specific rooms in those two facilities. And some of our acute care facilities may not have those rooms. So you need to check to see if your facility has such a room. So what we're talking about is aerosol-generating medical procedures take place in an airborne, isolated room. So that's what you're asking your employers. Do we have an airborne, isolated room? And if so, where is it? So let's be really clear about that. And again, long-term care and community, you don't have them. I can unequivocally tell you that I know of no long-term care facility that has an airborne, isolated room. And if I'm wrong, feel free to send me an email. It'd be good to know. The Chief Medical Officer, whose name is Dr. Strang, has announced that new testing sites at existing hospitals in the province. We were not provided with a list of these sites. I found out where these sites were from a news release. They also plan to open community-based sites in the near future, and they may have a community-based paramedics performing in-home tests at some point after that. It's worth noting that paramedics who perform tests will be wearing N95 masks. So we find that a bit disheartening that paramedics are going to be provided with N95s to do the test, but our nurses aren't. Patients who have symptoms and have traveled internationally will be directed to one of these sites for testing. The Department of Health is recommending that nurses and others involved in testing wear only surgical masks. Obviously, I keep repeating this because it bears repeating. The Nurses Union rejects this position and suggests all nurses testing potential COVID-19 patients should wear fit-tested N95 masks. Long-term care and home care. At this time, we have very little information regarding plans to deal with suspected COVID-19 cases in long-term care. Presumably, confirmed cases will be removed and quarantined, but we don't know that for sure. So that was a suggestion of the Nurses Union, that if someone tests positive in long-term care, they should be removed from that home and put in one of our acute care facilities with the room so that they're not spreading it through our long-term care facilities. Families and visitors have been directed not to visit long-term care facilities if they have traveled internationally, whether they have symptoms or not. Workers, including nurses, are permitted to work even if they have traveled internationally, provided they do not have symptoms. So if they do not have symptoms, they should get tested and seek medical advice. If nurses are sent into quarantine, usually 2 weeks, due to a potential exposure, employers are expecting them to use their own sick leave time. This is going to be on the agenda this afternoon as well. I'm going to ask about whether or not nurses and other healthcare workers should be required, if they're isolated, to use their own sick time. If a member is required to go into quarantine and does not have sufficient sick leave, please call here and talk to one of our labor relations reps, because that is a very specific thing, and I can't give you advice on that today, but call and talk to your labor rep, and they will talk to you about next steps. At this time, we will start answering questions as best we can and share your comments and concerns with other members on the call. So let's go to questions. I'm an older worker, considering among the vulnerable population. Can I refuse to care for COVID-19 positive patients or participate in testing based on my age? So the answer to that is, if you're an older worker and you're concerned and you're asked to look after a positive COVID-19, we suggest that you talk to your co-workers and see if someone will volunteer to look after that patient once you've expressed your concerns about your age and perhaps maybe have diabetes or whatever. We don't have the right to refuse work because of your age, but you can talk to your coworkers and see if perhaps one of them would agree to care for that patient. Do you think there will be a time when nurses and other healthcare workers who travel internationally will not be permitted to return to work immediately? I'm not sure. I think that chance is coming, but as of right now, you have to display symptoms. So you have to have traveled. Let's say you get back last night from Italy and you have no fever and you have no cough, then you will be expected to go into work. Will the NSNU be proceeding with pre-retirement and AGM events even if the risk associated with large-scale gatherings? Well, to that point, we agree that we have our AGM coming up. We have a pre-retirement seminar. We have all kinds of educational events happening in this office. We have a conference call with our board of directors who, as you know, give direction to the organization in between AGMs. And there's a scheduled call tonight at 6 o'clock with our board, and I will be we will be announcing to discuss this very issue, and we will be letting you know as soon as we have made a decision on all of those things. What will the NSNU's position be if there comes a time when N95s are simply not available worldwide? Well, that's a tough one. So today, when we go to meet with the Department of Health and these infectious control people, we need to have a conversation with them about why are you saying N95s are not necessary. Apparently, they have scientific evidence to say it isn't necessary. I want to be really clear. You know, the Department of Health and the employer are not out there saying we don't care about the safety of nurses. Like, we don't care. We're not giving them N95s, and we don't care. That is not what they're saying. What they're saying is, in their view, based on what they're reading and the scientific evidence they see, it is unnecessary. We're saying that we believe, based on the scientific evidence we're reading, that it may be unnecessary, but why would you risk it? That's our position. And if we were also assured from the health authority that there is no problem with the supply of N95s to date. We were told that very publicly at a press conference that the health authority is not concerned about that. And if that is truly the concern, we're not having them because we're not asking nurses to wear them because there's a shortage, then that's a different conversation. And we're very prepared as an organization to have that conversation about maybe some of the suggestions would be maybe we have a wing in every region, and only nurses and others that are necessary for the care of those patients will be providing that care. So there's no need of the kitchen staff going in to put a tray down. The nurses will have to look after that, and they will have N95s. So if the issue is because we're scared we're going to run out, then that's a different conversation that we're very prepared to have with government and the employer. Is COVID-19 similar to influenza? The difference between COVID-19 and influenza is COVID-19 is now a pandemic. And what a pandemic means is that it has traveled so quickly and affected so many people internationally. So it's not just confined to China or North America or Europe. It has come through borders. It's now in Canada, obviously. I'm not sure if the case in New Brunswick is confirmed yet, but there may be a case in. So it's coming, and it's a little bit different than the influenza in that and we don't have a vaccine yet for this. And it's just, I think the way it's caught the world off guard. It's just traveling so quickly. But luckily, it doesn't seem to be affecting children, which is a good thing, and that's a great thing for our IWK colleagues. And there has not been to date any child that has gotten the COVID-19 that has ended up being in an ICU, that they were that ill, that they have not required hospitalization in an ICU. And as you know, many of them that have COVID-19 are elderly, and they have pre-existing comorbidities like diabetes, congestive heart failure, all of those kinds of diseases, along with their 75 or 80. So, you know, the biggest concern right now is for our seniors. In the event of an outbreak, where will relief workers come from to assist nurses working in long-term care? We are not staffed at the same levels as acute care, especially in rural Nova Scotia. Amen. Like, long-term care is a big concern of ours. We're very concerned because we don't have very much licensed staff in long-term care. And if, you know, they came in contact and the whole staff has to be quarantined, where are we going to get the people to look after our folks in long-term care? To be honest, I don't know the answer to that. Those are the kinds of things that we want government to be telling us. Do you have a plan? And if you have a plan, what is it? And we'll be happy to share it. To date, the only plan that we've talked about in long-term care is restricting visitors. That's it. That's all. That's all that we've talked about, is restricting visitors that traveled internationally. I understand some of the long-term care facilities have gone a step farther, and I know of at least one or two that are restricting visitors, period, whether they traveled internationally or didn't travel internationally. But most of our long-term care facilities are acting like they act when there's the flu outbreak or a GI outbreak. They restrict visitors and they sort of lock the facility down, which we think is a very reasonable thing to do, and we agree with our long-term care employers when they make those kinds of decisions. Home care nurses are vulnerable, as we often go into unknown, unsterile environments. Even though we have PPEs, we don't know the travel history of our clients, families, and visitors. From the union's perspective, at what point should we be suspending our visits? I'm not sure if that question is a good one, but I think it's right today, as of this date, it might be a bit premature because we do not have a case of COVID-19 in the province of Nova Scotia as of whatever time it is, 11:30 today. That could change tomorrow, but today we don't. So we wouldn't be talking about suspending visits. However, I think this our VON nurse is a great question. I think it's very reasonable as part of your assessment, and maybe we'll have a conversation with the employer, the VON, the employer, after this teleconference, to suggest to them that we all know that there is an assessment that's done over the phone before you do your first visit. I think it's reasonable in that assessment for them to be asking the questions. Have you traveled internationally? Does anyone in the house travel internationally? Do they have a fever? Do they have a cough? And I will make that suggestion to our labor relations staff that deal with VON, that she should reach out to the employer, because I think it's totally reasonable to be asking those questions. And we'll look into that. But for now, VON nurses, it's job as it is. But I have no issue and will defend if a VON nurse, ask those questions when they go in to visit their client. If they can ask, I can tell you that lots and lots of our seniors now are telling their families, if you go internationally, if you go this week to wherever on your March break and you come back, I think it's reasonable for people to say, I prefer you don't visit me for 14 days, just in case. I think that's a very reasonable thing for any of our seniors living at home should be saying to their children and grandchildren if they're gone away for March break, because they are way, way more susceptible to getting COVID-19. And more importantly, if I get COVID-19, and most of you on the call do, you're going to have a cough, you're going to have a fever, and you're not going to feel well for a bit. But you're not likely going to die. So that is so different than seniors. So I think advice should be, just like if I had the flu. If I had the flu, I wouldn't be visiting my 93-year-old mother. I think it's reasonable to have those kinds of conversations with your senior clients to say, listen, if your kids and grandchildren are gone off internationally and they're back, ask them to self-quarantine from you, the grandmother, for 14 days. Can nurses refuse to care? This is another question. Can nurses refuse to care for residents in long-term care if they or a family member have compromised immune system? If so, will they be paid, and from what funds? The answer to that is no. You cannot refuse to care because you have a compromised immune system. You can't just say no, I'm sorry, but you can't. And if you decided that you're a nurse and you decided that I have a compromise and I'm not comfortable, then you will call in sick and you will use sick time. And you'll have to have that conversation with your manager. And they're likely going to say no. But have a conversation with your manager. Again, we have reassignment, but you're talking about caring for someone that has not been diagnosed with COVID-19. Our view of the world is if you're in long-term care and a resident gets diagnosed with COVID-19, our view of the world is that resident should be transferred somewhere else, so that other residents don't get the disease. That's our position, and that is what we have been telling government and others, that's what should be happening. So you wouldn't have to refuse, because hopefully that resident is not in your care anymore. If you're unable to return to work for 14 days because of symptoms or spouse's symptoms or international, what funds will be used to pay us? To this date, as of right now, it's sick time. So if you have sick time, that's what you'll have to use. There is an agreement that you're not going to have to get a doctor's note, but they're going to take your word for it. I was in Europe. I have a fever, or my husband has a fever. Both you and your husband would have to be quarantined for 14 days, and it's sick time. You don't have to have a note. You just have to call your manager, call your employer, and let them know this is happening. If you don't have sick time, that's a conversation you're going to have with your manager. There's all kinds of options for you. Perhaps they'll let you borrow from future sick time. They're not obligated to, but of course I'd be encouraging them. The union would be encouraging to be reasonable. Another question, both my spouse and I work in the same facility, and I'm being treated for COVID-19 long term, and I prefer to have COPD. I was like, that's not. Both my spouse and I work in the same facility, and I am being treated for COPD long term, and I prefer to have N95 masks for us. As of right now, the government and the employer disagree. They disagree that anyone needs an N95 unless they are treating someone with COVID-19 that's been diagnosed with it, and they're going through the procedures I talked about earlier, bronchoscopy, suctioning of a trach, anything that produces sputum. That's the only time the employer and government agree that N95 should be used. Our position, the nurses union, is that everybody can't have N95. So in this case with COPD, if there's no diagnosed patient or resident in your facility, then no, we would be saying you don't need an N95. You're at the same, we have to be careful that we don't have everyone out there asking for N95s, because we understand that if there isn't a shortage, there's going to be a shortage. And so we can't willy-nilly have people asking for N95s just because they're scared. We're presenting scientific evidence to government and the employers today about nurses that are testing for this. Testing, which is different than even a triage nurse. In a regular triage emerge job, we're not saying that all of those nurses need N95s. If a healthcare worker is to go on vacation to the Dominican Republic, where there are no travel restrictions, COVID-19, and the Nova Scotia Health Authority decides to put the healthcare worker off, even though the worker is asymptomatic, is the worker paid sick time? Yes. So you will be paid because your employer put you off. It wasn't you, it was your employer. Now, if you don't have sick time, we're back into that same old argument about how do we do that. And our view would be that the employer should and can lend you sick time. Does a nurse self-quarantine if she's been traveling in an active area? How would her salary be covered? Again, these are lots of the same concerns. No. If you traveled internationally, the rule is you're only quarantined if you have symptoms, which is an unexpected cough, a cough you didn't have yesterday, or a fever of over 38.5, I believe, 38 or 38.5. My question is regards to the new information regarding staying out of long-term care facilities within 14 days of traveling internationally. I am a long-term care nurse at the Cove Guest Home in Sydney, Nova Scotia. I have travel plans for the end of March to Norway. Norway has not confirmed any cases and no travel bans, but I'm wondering where I stand with the union and the province regarding travel and returning to work. Again, have a great time in Norway. Take, all the precautions you take when you're traveling abroad, and nurses don't need to be told this. We wash our hands all the time. We use alcohol we don't drink it. We use it on our hands like it's going out of style. So you go on your trips and you look after yourself as best you can. Try and stay out of big crowds. And when you come back, hopefully you won't have a symptom. If you don't have a symptom, you go back to work. If you do have a symptom, again, you're quarantined for 14 days, and during that 14 days, you will be using sick time. If our workplace decides that international travel will require 2 weeks of quarantine, and I'm able to complete my work from home, does my workplace have to honor that and pay me for my time? Conversation you need to have with your manager. There's very few nurses in this province that are able to work from home. But if you can, then you can have a conversation with your nurse manager to say, I can do this from home. Are you okay with it? If she says yes, then yes, you're getting paid. You're not using sick time. You're getting paid as if you were in work. If I lose money due to needing to cancel a trip because of my employer, does my employer have to compensate me? Yes. If they told you that you need to cancel your trip, we're not allowing you to go. It's just the same if they cancel your vacation and you had a vacation booked. They have to, upon receipt though, you have to prove that you paid for whatever it is you paid for, the airplane, your hotel, all of those. You have to prove with a receipt that you're out the money. Just like, and it can't be, I thought I should go to Hawaii next week and you're telling me I can't go and now you need to pay me. No, you'd have to show the plane, the airfare, and that's what you're getting receipted. For those who are quarantined for query virus, what resources are or will be available to make up lost wages? Sick time. So, a lot of these questions, I want to read them because I want to give the people that took the time to email these questions to us, I want to make sure that I'm addressing the questions. But sick time as of right now. At this point, we are being told to apply for EI benefits. However, EI requires a physician's signature, and due to being quarantined, this is obviously not possible. So, as of yesterday, I believe that Prime Minister Trudeau lifted the restrictions, some restrictions on EI, EI sick. I'm not sure about the physician's signature. That would be something I'd probably call EI about and see what they have to say. Because you're right, the employer is not allowed to require any of us to bring in a doctor's note if it's for COVID-19. They are not permitted to do it. So I suspect that if it's COVID-19 and that's why you're going on EI, my inclination would be that they would follow that the directive of the medical officers in every province. We should not be having to use personal accrued sick time for something that is outside of our control. And when that sick time is gone, then what? Again, I don't disagree that, I'm being told that I have to quarantine myself. I shouldn't have to use my sick time. No disagreement here. However, it's not in our collective agreement. It's something that probably we'll talk about in the next collective agreement, but as of right now, that's all we have is sick time. That's all you have is sick time, and there's nothing more. I'm going to discuss it with government, but they don't have to, and they may or may not. Once COVID-19 hits our facilities, if we are not educated, fitted, and provided with N95 masks and possibly protective eye gear, can we refuse to work if we're not protected? So again, if you're testing for COVID-19 and or you're treating someone that has been diagnosed with COVID-19, in our opinion, you have the right to ask for proper protective equipment. And in our view, this is the nurses union and the other healthcare unions, that is N95 as of noontime today. Now again, I'm going to a meeting at 1:30 where government and others believe they have enough evidence to prove to us that the N95 is not necessary. And if that happens, then we will be sending out a campaigner this afternoon with our change of position. But as of right now, we are saying if you're testing for or treating someone with COVID-19, you must have an N95. And if your employer says no, then in our view, you talk to your nurse manager, you do all of the steps on a right to refuse, because you do have a right to refuse, but you need to talk to your manager. You have to talk to your JOSH committee, and if you get nowhere, you call the Department of Labor. And you might want to call us at 1-902-469-1474, and we'll help you with that. It has been widely stated that the threat of COVID-19 is greater in the older population. Can older nurses expect that the employer will take this into account when assigning known cases to the nurses? I hope so. They don't have to, but I think it's reasonable for a senior nurse, with especially those that might have COPD, diabetes. I think it's reasonable for that nurse to say to her nurse manager, could someone else be assigned to that positive COVID-19 patient? The nurse manager doesn't have to, but she could. She has the right to reassign, and within that right, there's volunteers. So I'm hoping that if I had COPD and I'm 66 years old and a COVID-19 was admitted to my wing, I'm hoping that my colleagues, my other nurse colleagues that are younger and healthier, would agree to care for that patient. Because let's remember, again, if an average Nova Scotian that's healthy with no underlying illnesses like diabetes and COPD and all of that, and they're 40-some years old, if they get it, they're going to be sick like they had the flu. But they're not likely to die. So, we can't panic people. This is not about panic. The panic that everybody's seeing is how contagious it is. It is more contagious than the flu. It is more contagious than your run-of-the-mill cough or sneeze or common cold. It is very, very contagious. So that's why everyone is so hyper about this illness. It's just how fast it's spreading. I mean, countries are going from 30 cases to 1,000 in like 7 days. So it's just, Italy has pretty much closed. Air Canada's not even flying into Italy. It's because there's so many people that have the COVID virus in Italy. But we're still at, how many deaths?
In Canada?
Yeah, no,
4,
in the world.
Over 4,000.
There's about 4,000 deaths, and how many have been diagnosed?
About
121,000. So the risk of death is still pretty low with COVID-19. The common flu is more likely. Car accidents are more likely, to be clear. N95 masks have been on back order here, this is in Yarmouth, since January. The regular surgical masks with visors also have a back order. Apparently there are a small amount in stock, but they are being rationed to the units. See attached pictures. We are definitely not prepared. Also, we have a testing site here, and there are no N95 masks in the clinic. Well, you can't be tested for N95s without N95s. So I will bring that up. I was told unequivocally by the health authority that there was no issue with supply. Obviously, that is not accurate. And so that will be part of my conversation this afternoon, 100%. I will be talking about Yarmouth Regional Intensive Care Unit. What are your thoughts for taking students from community colleges? That's fine, absolutely. There's no reason why you wouldn't take students from either community college or the universities. There is absolutely no reason. I'm advocating for our hospital as our ICU has very recently closed 4 ICU beds due to lack of funding. We are currently only have 6 beds. I know all about that at the Aberdeen, and I, as recently as the first of this week, had a conversation with the Minister of Health about that. And he committed to me that he was going to look into the closure of these beds in the ICU at the Aberdeen. And you can't look after if you don't have the beds. Valley View. I work in long-term care, and our residents are going to be tested when we don't have swabs. The Department of Health took our swabs. Heard this morning. If we are not using them, then they were taking them. Okay. So, as of right now, there is no plan to test residents within the long-term care sites. The only people getting tested are those that have international travel and are exhibiting symptoms, fever, dry cough, or doesn't have to be a dry cough, a cough. So we're not just mass testing everyone. And the other restriction on that is what they're asking people to do is call 811, tell them your story, and they'll either tell you can be tested or you can't. Like, they're not just going to test. I can't walk into the Cobequid today and say, I think I just got back from Florida or I just got back from Italy. I would like to have a test. They're not going to test me. I'm not going to be permitted to have a test, only because I don't have any symptoms, so they're not going to allow it. Is it reasonable to gown PPE with a client in a home if they show no symptoms but have been in contact with someone who has traveled or traveled themselves? Well, I'm not sure why you would, but if you have a gown in your car and you want to, I guess you can put it on. No one's going to stop you. I think that's no different than if you're in treating someone with the flu. Nurses are pretty good about universal precautions. Nurses are pretty good. They know that they have to wash their hands after they exit someone's home. They know that if someone has bodily fluids that get on their clothing, they ought to go home and change their clothing. All of those things are reasonable things for our nurses to do. And trust me, if something happens or there's a discipline because of what you went home to change, we will defend you. And you know what? Your employer's not going to say anything anyway. Like, again, I don't want to make it sound like the employer doesn't care about us or doesn't care about our safety. I don't believe that to be true. I know they believe that N95s are not necessary when testing for COVID-19. They believe that, and they don't want to, if they thought that it was necessary, they'd be doing it. Is the government prepared for an influx of patients from long-term care to hospitals that are already overcrowded? And is the government preparing for off-site locations with negative pressure rooms? I couldn't answer that question. I have no idea. My view is we have a 90% capacity in our acute care. That is the truth. That's what the health authority is saying. We're at 90%. I believe we're probably well over 100%. I believe that that's the truth. We're well over 100 and sometimes more than that because we have all these patients in Emerge waiting for beds. So they're not in the 90%. I think, if the COVID-19 continues at this pace, mostly people aren't going to be hospitalized. So the majority of people are going to be isolated at home, drinking fluids and hoping to get better. The only people that are going to be hospitalized are those that are very sick with COVID-19, so sick that they're probably going to require ICU. In those cases, the employer is going to have to be very diligent about deciding what beds they're going to close, if any, what surgeries they're going to cancel, if they have to. No different than if there was a major flu outbreak. Decisions will have to be made by the employer about what beds they're going to be able to free up in order to get these beds to look after, remember, very, very ill COVID-19 patients. Because the majority of us, if we get it, are going to be fine and we're going to be home isolated for 14 days. So, if you don't have a Netflix subscription, you should get one. Because you'll be watching a ton of Netflix over the 2 weeks. testing by nasal pharyngeal swabbing, is an N95 required? 150,000%. No sputum, anything that could bring up sputum, N95, the shield, the gown, the gloves, the whole 9 yards. And that is without question, and the employer does agree with us on that. Like, the employer and the Department of Health, they agree with us on that issue. So, no, testing.
Mm-hmm.
Oh, sorry, I thought you meant you were, Jan, testing by nasal pharyngeal swabbing. That is the way testing's done. I read your question wrong. No, the employer and Department of Health are saying N95 is not required. We're saying N95 the nurses should have them, and we're saying that because there's a group of scientists out there that say, we think it should, and there's another group, including the Public Health of Canada, that says not necessary. We're saying, as nurse unions, not just in Nova Scotia, across this country, that if in doubt, give the nurses N95 for heaven's sakes. If you don't know, if you can't look us in the eye and say, with 100% certainty, that I'm not going to get it if I do this swab, because remember, I'm doing a swab on people that already have symptoms. We're not just swabbing everybody, people that have symptoms. So if you can't look us in the eye this afternoon and guarantee us that that's not going to happen, then we're going to continue with our position on N95s.
We have two on the wall there, on the monitor.
If we contract COVID-19 as part of our job during our work hours, not through travel, would this be a WCB due to exposure versus sick time? Great question, and I've been thinking about that myself. I think there could be a case made for that. I would, if I was a nurse that got it, and I can prove, because remember, we have to prove that you got it from work. It's not, I think I got it from work. You have to have a direct correlation. I got it after I treated Chris Albrecht, and 2 days later I got it, and I wasn't provided with proper equipment, PPEs, right? I wasn't provided it, and so I can sort of make the correlation there, that I just happened to look after Chris, I didn't have proper equipment, and now I have it. I'd be filing a workers' compensation claim, for sure, and the worst that can happen will be denied. And even if it's denied, you can appeal. So, I'll give workers' comp, I sit on their board of directors, I will give them a heads up that this was a question and they ought to be thinking about an answer for it. How will we know if a resident has COVID-19 in long-term care if they are not tested? If we suspect, should we send to hospital? If it comes back positive, will the unit the resident was on then be locked down? Do we then test all other residents? Will they go to acute care? Great questions. I wish we knew the answer to them. Those are all questions that we don't know the answer. Our position is, if someone tests positive for COVID-19 in long-term care, they ought to be transferred out. That's our position. We don't have anyone to agree with us yet, but I'm assuming that's the plan. But would they be testing all the rest? I don't know. I don't know, and I don't know if they'd lock down the unit. I have no idea the answers to those questions. But there are people, I'm told, that are working on these answers as we speak. Should the employer refuse us to travel, stating we are essential services and cannot afford staff to be quarantined, is the employer responsible to provide trip refunds if you have no cancellation insurance? Yes. So this is not, I'm nervous and I don't think I'm going on my trip. So I'm going to go tell my employer I'm willing to cancel my trip, and the employer says, great. That's a different conversation than your nurse manager coming to you and saying, Janet, I see you're going to Italy next Monday. I am telling you, you cannot go because you're a nurse in long-term care and blah, 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 blah. If that's the case, and you can provide receipts, whether you have insurance or you don't have insurance, your employer will be obligated to refund your expenses, be it airfare, hotels, whatever. but they have to cancel. You don't decide, I'm not comfortable going and I'm going to cancel. Then you're on your own.
There's one more coming.
One more. Currently are the recommendations for secretion-inducing interventions should only be done with specific PPE and in a negative flow room. This would make a lot of required care in the community not feasible. Correct. That is caring for someone that's already positive. So that's not testing. So, for example, Cobequid is one of the test sites. So there's a lineup over there today of people getting tested. The people in that lineup would have to have had international travel and had fever and have a cough, and they're waiting to get tested. Those tests, those swabs are sent, my understanding is to Winnipeg. I think it's 48 hours or so. I think that's when the test results come back. Once they come back, somebody will be contacting me, Janet, to say, you've been positive, you need to quarantine yourself for the next 14 days. And here's what you're going to look for, here's what you should expect, this is when you should be better, and if something gets worse, like breathing, it's a respiratory illness. If you're breathing, if you get really, really short of breath or you're having trouble breathing, then go to your emerge department. And that's when, now I'm diagnosed, I'm in emerge, I have to go into those special rooms, and everyone that's doing anything with me that could require sputum, like a bronch or, well, I don't have a trach, but if I had a trach and they had to suction me, then those people, and everybody agrees, need to have N95s and proper equipment. So we're in agreement on that. Where we are disagreement on, as I've said many times, is the whole testing of people that have symptoms.
The regular procedures in the community are status quo, so they're not screened in, you keep doing the regular stuff. She's talking about secretion-inducing procedures in the community care right now.
Like what?
If they're not screened in.
Yeah, they're not screened in, they just still do it. So if you're looking after someone in the community that you have to suction or do trach care, right, you would do tomorrow, no, I shouldn't say tomorrow, you would do today what you would have done yesterday. And the reason I'm not saying tomorrow is because every day there's new directives come out on this. Like, not just every day. It was an epidemic yesterday when we woke up, and it was a pandemic by 2 o'clock yesterday afternoon. So it went from an epidemic to a pandemic in 4 hours. So you really have to keep on top of this stuff. You really have to, we're trying really hard to stay as current as we can. We have a website dedicated to COVID-19, and we have a webpage, NSNU.ca, just on COVID-19. We have, I would say, at least 2, if not 3 staff working on this pretty much, that's their whole work day now. Paul, who's our occupational health and safety person, he's on the phone all the time with the other nurse unions across this country to make sure that we're all singing from the same song sheet and we're all doing whatever we can to protect our nurses. And that's our job. Our job is to protect our nurses, and we're going to do that regardless of what people disagree with us, whether or not your employer may or may not agree with us. That's too bad. I mean, our job is to protect you in your workplace. And in our view, as it stands right now, those sites, the 7 sites or wherever they are, that are testing for COVID-19 today, they should be having N95s on. That's our position. I understand that they don't. I heard that, but I disagree. And if I was a nurse doing that, I'd be asking for an N95.
We have 4 minutes, but we can go a bit over if you'd like.
Yeah, we have 4 minutes remaining on this call. There's 2 more questions. I'm happy to stay on as long as you need me to stay on. I'm also going to do a video soonish on our position, so you can bring your little laptop, not your little laptop, bring your laptop to your nurses union, unit, and show your manager. I don't care. I'm pretty very vocal about the N95s, and so blame me if you have to. Jennifer asks if we wear surgical masks because our public health refuses N95s and contract COVID-19 from a patient, can we take legal action if a year from now scientific evidence shows that surgical masks were ineffective against COVID-19? That's a great question. In this case, you'd have to fill out your workers' comp. And once you fill out your workers' comp, the thing about workers' comp is it's no-fault insurance. So if you can relate it, you're gonna have to relate it back to that patient, right? You're gonna have to prove you got it at work. And once you've made that leap, you would be covered under the workers' compensation. And when you're covered under workers' compensation, you don't have the right to sue. They don't have the right, for example, we, the workers, gave up our right to sue, but what the employer gave up is, for example, they told you to wear an N95 mask, and you went in and you contracted the disease. They can't not pay you because you didn't follow their directions. I'll say it easier than that. We have laws in this province that if someone's working on a roof, they need to be tied down. So they need a tether so that if they fall off, they don't fall to their death, right? If a worker were to fall off a roof and the equipment was there for him to tie himself off, or he or she decided not to, and they fell to their death, or fell and they can't work again, they will still get workers' comp, even though they didn't do what they were supposed to do. That's what the employer gave up, and what we gave up is our right to sue the employer because, for example, they didn't have a tether there for me. So that's the way workers' comp works, and that's just the way it is. And so you would have to prove that you got it from the patient, and if you could prove the direct correlation you got it from the patient, then you'd probably have to go the workers' comp route as opposed to the suing route. I'm hearing reports of swab shortages in Nova Scotia. People are coming to take the viral swabs for use elsewhere, i.e. public health clinics. Other provinces should sound like they're running out of swabs. Can you check into this? Sure. I haven't heard that. I'm not saying it's not true, but that hasn't been communicated to me. Right now, the communication is on this COVID-19 is very, very fluid. And in fairness to Department of Health and the employer, every day there's new stuff and there's new people to communicate. They have to communicate with all the long-term care employers. They have to communicate with all the health authority and all those facilities. They have to communicate with VON. They have to change things. So they make a position on this for long-term care today. It could be different tomorrow. So there is a lot of conversations happening. I want to reassure you that in our view, other than this N95 discussion, the employer is trying really hard to be on top of this COVID-19. They're working really hard. I know that Dr. Strang has a call with his colleagues from across the country every single day talking about COVID-19 with the chief medical officers from across the country. And I know a lot of his staff are doing that as well. So I do want to reassure you that work is being done. A lot of work is being done on this COVID-19 in the province of Nova Scotia. And it will continue. We're just starting. I think it's going to get a lot worse before it gets a lot better based on what we see in other countries. One more. Last question. If the employer and the health authority won't equip and allow testing on those showing COVID-19 symptoms and the nurses get sick because of this lack of action, so first of all, anybody that is showing COVID-19 symptoms are to be tested, and there's no argument there. As I said earlier, you have to call 811. You have to say, I have this. You have to have the symptoms, and you have to have travel to a place that had COVID-19, and then they are doing. That's what the 7 sites are doing. How can we prove employment exposure based on WCB? Why are we tolerating this lack of testing classification since it carries with it a need for the employer to then provide protection to care for these patients? There is no argument that if you have symptoms and like they have a checklist at 811, so if I called 811 today and said, I just got back from Italy, I have a temperature of 38.5, I will be directed to Cobequid to get tested by the nurses in Cobequid. No questions asked. But if I come back, I've just come off the plane from Italy, I feel fine, they ask a bunch of questions on 811, and they'll determine whether or not I'm to be tested, the 811 nurses. And if there's symptoms and you come from a place that had international travel at all, then you will be tested. The 811 will direct you to a site to be tested. Absolutely. That is not in debate at all. And that's it for questions, but that doesn't mean that you can't ask questions. You can send us an email, and someone here will answer you about whatever it is that you're concerned about at NSNU, Nova Scotia Nurses Union, .office@nsnu.ca. So, and everybody knows my email address, janet.hazelton@nsnu.ca. If it's after hours, feel free to send me an email. I'm fine with that. And I will either answer you immediately, or I will send it to someone who will answer. But the big thing I'm saying to you right now is don't panic. I think it's under control. I think it's concerning because how contagious it is, but I do think that it's under control as best it can be in this country. So, and you can rest be assured that the chief medical officers are all over this. The federal and provincial governments are all over this. The nurse unions across the country and other healthcare unions are all over this. I think if we responded this way to lots of other things that are going on in our healthcare system, we'd have a better system. If we got the attention on this, like this, if there's anything good comes out of this, I'm not suggesting there will be, but I think it's going to shine a light on the staffing that we have in both acute and long-term care in the community. I think the lack of staff we have in healthcare, I think, will become pretty evident if this becomes a big, big issue in this province. Anyway, thanks for your time. Thanks for your attention. Remember, we have a webpage at nsnu.ca dealing specifically with COVID-19.
A recording of this will be posted.
Yeah, and this, if you found this helpful at all, you can tell your colleagues that they can come on and listen to it again. We've taped this, and it'll be on our website, and you can just go to our website and listen to it listen to my voice as many times as you like. Anyway, have a great day. Stay safe, and those of you doing the testing, ask for an N95. Thanks. Bye.